Hello, Dr. Stracks. How are you?
I'm good, thank you. I'm good. Let's see. You just sent me some information within the last few hours, so I usually need 24 hours. Do you want me to review it real quick as we get started so that I can see what you wrote?
For sure.
Okay, let me just do that. So 29 years old, ankylosing spondylitis. You're diagnosed when you were 22. And sciatic pain. And then you started gluten-free diet, lactose-free, pain got worse. And then severe, pain gets worse, remove carbohydrates, more athletic, still some pain. The changes, worse if you eat a lot. Schubiner, Alan Gordon. Perfectionism, high achieving, obsessiveness, overthinking, people pleasing, pain changes in intensity. So not a whole lot of drinking anymore, a little bit of tobacco.
Actually, I was smoking a cigarette right now.
So you can see content creation. You do both of those. And work is good. You eat well. You exercise regularly. Where do you live currently?
I am living right now in Thailand, but I am originally from Spain.
Okay, got it. Your dad. How old's your brother?
My brother is 3 years older than me. I'm 29,
Okay.
so he's 32.
Got it. Okay. So that gives me a good overview. Tell me, what do you know about the mind-body connection? What have you learned so far?
As much as I can. But I will, let's say, first contact Dr. Sarno with the documental around 2 years ago. At that moment was important, and I read the book, but I was not aware about how important was to truly believe on the diagnosis. So I continue until recently. I continue thinking that the main reason why I have inflammation is like the relationship with the gut health and the immune response, the autoimmune response, no? Because that's the trend that I was following for healing. Then I will say 4 months ago, or 5 months ago, I decided to get more serious into healing, and I was doing very good exercise, very good diet, everything very good. But suddenly, 3 months ago, I was with pain 2 out of 10, but suddenly I got pain again, and I was in 6 out of 10, and I was doing everything so good. So at this moment, I was like disappointed, like something was missing. It doesn't make sense that, if I am eating so good, exercising so good, why I'm having this pain. I don't want to accept, just like I would like to be better. So then I start researching more, and it's when I get into Alan Gordon and Dr. Schubiner and the movies and the forums. And what I understand is basically, and also I have done one coaching session. There is one coach that is already helping me. And I am doing interviews to people that they heal. So I interview 4 people that they heal completely. And what I understand until now basically is pain. What I don't want is to feel pain. Pain is created by the brain, like anything that we experience.
Mhm.
So the root cause is our brain. That's the first thing, no? Even though I feel my pain here or here, we have signals here. But the signals, the meaning is created by the brain. The signals are neutral. It's the brain who give the meaning to them. And the meaning can be pain. So, and if you have also some like fear to pain, that can become like more stressful. For me, feel like very similar to anxiety. You have a feeling that you don't want to experience, like you don't want to experience pain. So if you feel a little bit of pain, you focus or want to fix it, or you want to get rid of that or escape. So that creates like a loop that is creating more pain. That's basically what I understanding. And also that there is a subconscious level or another layer that is related with if you have chronic stress created by some personality traits or traumas that makes you navigate through life with some type of chronic stress that maybe is quite invisible for me because I have been avoiding somehow. These two things connected create the pain.
Got it. Figured out.
But I have some doubts.
I think, let me check this out with you because the description I think is not totally accurate in what you said about pain.
Okay.
And so pain comes from the brain, but it's not the brain's interpretation of pain. That's an old model that I think the science has moved past at this point. So the brain interprets what's going on in the body, getting all the signals, but it's not getting pain signals. There's no such thing as a pain signal. And then it takes all the information and decides if pain is then the right response to those signals, but it's not getting pain signals. That's a subtle difference, but I think maybe is what I heard you say.
That's my actual understanding. Maybe I didn't explain myself properly. Like, yeah. I understand that point. Signals are signals.
Right.
Exactly.
Yeah. And so when you have ankylosing spondylitis, you're getting signals of inflammation. You're getting signals of events that are happening in your joints, in the SI joint. But there are plenty of people who have ankylosing spondylitis who don't have pain. And so those signals mix with all the rest of the signals, and then your brain decides whether pain's the right response or not. And so it's not that ankylosing spondylitis is or isn't TMS. Ankylosing spondylitis is a result of inflammation, but plenty of people with AS don't have pain. And so asking whether it is or isn't wouldn't be the right question. The question is, can you work on the emotional and psychological side to minimize or eliminate the pain, even though you have AS? And the answer to that is yes, you can do that.
Very interesting what you are mentioning. So what you say, okay, I have some question, but let me, what I understood is that you say that AS, like we have inflammation, there is something, let's say, structural, that could be this inflammation, but it's our brain, in any case, who is going to choose how to interpret the signals of information as
Correct.
More or less pain, right? So,
well, no. I'm going to push back on that. Again, it's not interpreting more or less pain. It's just interpreting signals. Your brain's then going to decide if pain is the right response. So the signals go this way, the pain goes that way, and your brain gets to decide if pain should be present based on what it's sensing in your body.
Okay, and I get this, but I have one question. So people, when you apply the TMS therapy,
yeah,
people with AS don't reduce their inflammation? They will continue with the same amount of inflammation?
Yes and no. It's TMS therapy is not aimed at reducing inflammation.
Okay.
And so the goal of TMS therapy would not be to say to somebody, we want your inflammation to be lower.
Okay.
We've seen that happen, so it's possible, but I've never seen anybody eliminate the inflammation using TMS therapy. But I've seen people feel much better, and we've seen people whose inflammation scores seem to go down after TMS therapy.
Okay.
And so if somebody comes in with a disease of inflammation and says to me, can I fix this with my brain? My experience is that it doesn't get fixed completely by doing this, but TMS therapy is part of what helps people feel better and part of what makes inflammation go down.
Okay. Well, I don't know exactly how to approach, how would you like to approach the conversation, but as you are saying things, I have questions. Like my main goal is to know if TMS approach is the right approach. Like that is the main goal for me, no, of this session.
So let me answer that. If you're asking like is TMS the answer, I would say no. Okay. TMS is not the answer. Is it part of the answer? Absolutely. Absolutely.
And what will be for you the answer? It's possible.
It's a combination of things. It's working on the mind, it's working on diet, it's working on exercise, it's potentially taking supplements, maybe medications, and trying to reduce inflammation as much as possible while understanding that inflammation doesn't equal pain. And so anybody who's got an autoimmune disease or an inflammatory disease, in order to get the best response, they're going to need to do a variety of treatments all together to try to produce the best results possible. But you may or may not be able to reduce the inflammation completely. But inflammation also doesn't equal pain.
I see. Okay, but you know, this is quite interesting because as ankylosing spondylitis, by like the definition is quite abstract. Like the way you get diagnosed of ankylosing spondylitis is based on if you have a few criteria, no? Like if you have a few symptoms. So I am pretty sure, like if you take 1,000 people with ankylosing spondylitis, they will have many things different, because I already know 50 people because I have a small community. And I see differences, big difference. Like some of them so big that I am like, we have different illness, like or we have different symptoms. So that make me think like that the concept itself of ankylosing spondylitis, why they put me that label to me, because I have the gene. I have the gene. I don't know what relationship have the gene with the TMS. And I have the sacroiliitis third grade. I don't know if you can see that in an X-ray, because I have here the X-rays.
Can you show me?
Yeah. This is something that I would like to see with you, because I have here X-rays of that. Let me see how I share here a screen. Okay. Can you see my screen?
Yes.
Okay. So basically, look, I will share with you I get the main data points that I want to share with you. First of all, in terms of inflammation, my creatine reactive protein is 5.5. So it's slightly high, right? And this was 1 year ago that I was having pain. I would like to check recently. And the speed of sedimentation is normal. So the only inflammation marker that I have that is that one. A little bit high, just to consider that. Then, in terms of the X-ray, let me see if I can do this bigger. Well, here you can see, you can read what I have here.
Right. small interspinous nuchal ligament calcification at C7 level, lumbar posterior interfascial sclerosis, left L5 transfer, megaphysis, bilateral grade 3 sacroiliitis. Okay.
The bilateral grade, I think, is the most related with the spondylitis, right? And
right.
And then here you have the X-rays. I will show you. I think this one is the most useful one.
Yeah, right. Yes. And
do you want to zoom or something?
No, I'm just looking at the iliac bones there, and go down a little bit, and so the joints between the sacrum and the iliac. You can't see me pointing, obviously, but there's some inflammation there. Yeah, there and on the other side, in there, correct. And so in most people, those joints are going to be clearer and there's going to be less haziness in there. And so I think that's what they're referring to.
Because for you, it's clear that I have here a level 3, like sacroiliitis?
I'm not a radiologist, and so I'm not going to try to comment on the level 3 or level 2 or level 4, but it's clear to me that there's inflammation in those joints.
Okay. And in this one, no? Like here, or around here, the hips.
Right.
Yeah. Okay. How do you see that? What do you see to see inflammation?
Let me see. Hold on for 1 sec. Let me see if I can find one.
Because in terms of structural damage or inflammation, that's all what I have.
Right.
You know, a little bit of the C protein reactive, or I don't remember the name. And what you see here, that's all the signals, like structurally based, that I have about inflammation. Pain, I have a lot. You know?
Here's a good example. And so I'm going to stop your screen.
Yeah.
I'm going to share my screen. And so you see this one, you can see the clear delineation here. And this one's a little bit more hazy. You've lost most of the clarity there.
Yeah.
And so that's what they're calling the inflammation.
Okay.
And so it doesn't surprise me. It doesn't make me think that pain is an inevitable part of your life. But it also, like, I do think that ankylosing spondylitis is probably the correct diagnosis.
Okay.
For you. In ways that sometimes, like, some of my patients are diagnosed with ankylosing spondylitis, even though none of those things are true. They don't have the gene, they don't have the inflammation, they don't have inflammatory numbers on their lab tests, but they have pain there. And so people say it's ankylosing spondylitis, which I don't think it is. For you, I think it's accurate, but like you said, right, there's a huge range in how people feel once they've been diagnosed with it. We're trying to get you to one edge of that so that you have the diagnosis, but you feel fine and do what you want to do without limitations. That's the goal.
Exactly. And I would like to know your perspective also about something, because you know, my main doubt about AES and TMS was that TMS, because it's supposed to be neuroplastic, so the pain is triggered by the brain, and there is no need of a structural damage of any type, and AES have or inflammation or immune, your immune system is also, like, you can see data points that can show your immune system like hyper-reactive. That shows that there are other systems of your body that are affected more than just the nervous system, no? But I have been talking with people that they heal completely from AS by changing the way they think. and they heal completely. And now they don't need to do a diet, or now they don't need to do exercise. They do, these people, they can continue doing exercises or a diet, but not because they need it. So my question here is, do you think it's possible that the process of the TMS is not only changing the path of the nervous system, but also our hormonal system, our immune responses, and finally the inflammation in our system by just changing the beginning, that is our brain?
I don't think there's a straightforward answer to that. So let me give you this answer. One, I haven't necessarily seen people completely eliminate their inflammation using the power of the brain. It wouldn't surprise me if people do, but I don't know them. So I don't generally see that. People who have inflammation, I've seen people lower inflammation. So I have a patient who didn't have AS. I can't remember what disease she had, but she reduced her inflammatory scores by about half based on just using TMS therapy. Like that's all she did, and her scores went down by about half. And then she went to Spain and hiked the El Camino trail. Which trail?
Yeah, El Camino.
Yeah. So, and then she went to Spain and hiked. So that was really good. I will also say this, right? We talk about the nervous system, we talk about the immune system, we talk about the endocrine system, and we talk about the digestive system. We do that because it's easier for our human brains to understand smaller systems than to try to understand the whole human body. But your body doesn't have a nervous system and an endocrine system and an immune system and a digestive system, a cardiovascular system. Your body's just one system, right? So your body doesn't think like, oh, I can't do that. That's the digestive system's responsibility. It all works together. And so if you understand that, then you understand how when you push in any part, it changes the rest of your system also. And so if you really work on relaxing your nervous system, that information is going to get passed on to your immune system. Your immune system is going to be calmer than it once was. Whether you can get your immune system to totally get back to normal, that I don't know. That's probably independent and individualized. And so, like you said, right, some people seem to have done that. People I know seem to have been able to do some of it, not necessarily all of it. But that's why any work that you do in calming your nervous system is going to get transmitted to other parts of your body as well.
Yeah, because, you know, this is something that many times when I am reading about TMS, I am missing that perspective, because I think even though it's not only about what areas of your brain are triggering that, for sure that's important, but this is going to have a full impact in your full body. As you say, it's only one. So this is going to change your immune system. This is going to change your cardiovascular system. Or we don't talk about the system. Let's say it changed everything, right? It changed the energetic field. It changed everything, no? So yeah, that make me think that maybe that's the reason some people they can heal by this way. But then, well, I'm going to make you a lot of questions. I'm going to use these minutes to the maximum. Okay. Then I talk with some people that they heal completely with the TMS system or approach, more or less, reading books, but just mentally. And what they say also is that sometimes, like doing diet or exercise, can be non-beneficial because you can believe that the root cause of your problem is not practicing exercise, or that your body is not prepared for accepting all type of foods. So this creates like a nocebo effect. So some people say that is the nocebo effect what is creating the pain, and not the gluten or the dairy. Just your belief around the food that you are eating, if that makes sense, no? So some people say like at some point you should even release completely the diet and the exercise, at least as a treatment. You know, what do you think about that?
I don't know that I would agree with that. I know what you're saying, right? That there are people who say like they've taken the power of their mind and they completely reworked what's going on in their body. I don't doubt that. Again, right? I haven't really met people like that for the most part. Like I don't know, I can't pull out, and I've seen a lot of people over the years, but I can't pull out somebody who I said, like, yeah, they had this terrible inflammatory disease and they totally reworked how they think and feel, and now it's gone. What I see is people who have done all parts of it. So the diet's part of it, and the exercise is part of it, and the supplements are part of it, and the brain thinking is part of it, and the brain training is part of it, and the reading and the education. And so that's generally how I think about it. And so when people have inflammation, when people have autoimmune diseases, I tend to think that the diet and the exercise are actually helpful parts. I see what you're saying. And, ultimately, what we need to figure out is what's most helpful for you as an individual. It doesn't matter what's helpful for people in general. And if for you, thinking that like your mind can totally make this better, there's no harm in focusing on that. There's no harm in doing that. And over time, you'll figure out like what's the best combination for you. And so maybe you decide to go somewhere and do a silent meditation retreat for the next 90 days, and it makes a huge difference for you.
Yeah.
Or maybe you decide to do that and not that much changes because your diet has changed, and so you change your diet back. And so, right, we're not trying to fix it tomorrow. We're trying to figure out what the best plan for you is for the next 50 years, 70 years moving forward. My experience is that it encompasses a combination of interventions rather than just one, but we'll find out over time what works best for you.
Okay. But you also say that you don't know anyone that healed completely from AS. Completely. No?
On the inflammation side, I know plenty of people who feel great.
But
right.
Like for me, it's like 0 out of 10, pain 0. Morning and you feel fresh.
It's
okay, the answer, eh? Like I want to know what is your experience,
I don't think zero pain all the time is the goal for people. We're human beings. Like life goes up and down. Sometimes we feel it in our bodies. And so I don't think of it. And I run into a lot of people who have a lot of perfectionism. And when we've got a lot of perfectionism, it's like, I want zero pain and I want zero pain always. That's not how I think about the world. And so my goal for everybody is that they feel as well as possible, as much as possible. But I also don't know anybody who never has pain.
Okay. No, for me, I see your point. At the same time, I like one definition of what is to be healed. That is when you don't suffer from symptoms and you don't depend on, and you are independent of any treatment. That's actually like healing, no? Because imagine if not will be like coping or dealing with your symptoms. But imagine that, I don't know, you have to take a pill one day so you don't have pain in your throat, but it's working perfectly, no? It's of honey and it works super. But it's actually you are feeling perfect, but you are not healed. The day that you can not take that, right? So
I would also say for you, the question initially sort of was like, is AS TMS or not? Like, if you don't work at the level of your mind, you're missing an enormous part of how you're going to get better. And so there's no universe in which I would say to you, like, it's AS, like, this doesn't matter. Of course it matters. And of course, the more you understand the role of psychology, the more you understand your feelings, the more you understand how it all fits together, the better you're going to be. And so absolutely trying to work on the psychological side is going to make you better than you are. What's it going to look like in the end? We don't have a crystal ball, so we don't know for sure. but I know a lot of people who have physical issues who work on the psychological side and feel way better than they ever thought they would.
That's a very important insight, what you are mentioning, because in terms of this, if the TMS approach will be beneficial for me, the answer is yes. No matter. So now, so in terms of my first question about this meeting, like it's solved. Like I will do it. Actually, I am already doing it, but I want to know a lot, and I want to heal myself to heal others, to help others.
Yeah.
So yeah, so I would like to understand a little bit better, no? Because it's interesting. Well, I don't know if it could be beneficial for you in some way, but I have been doing a big research for finding people that they heal completely. I don't know many, but I know 3.
Okay, good.
If somehow you are interested in knowing them,
Yeah, for sure.
Yeah, I can share with you the contact, or we can do a meeting or something, because all of them, there are masterpieces. Like none of them is by chance. Yeah.
I believe that.
Yeah. And just to let you know, in case, I don't know if AS is one of the common things that you have with your patients, but no, it's not the most common, no?
It's not.
I see.
Yeah.
I see.
And so I see some people who have AS, but I see a lot more of other diseases than that.
Okay. And what is the expected outcomes in terms of time frames and impact in your pain? Like what is a rational expectation, a range?
Good question. It's different for everybody, so it's hard to give a specific answer on that, right? I know people who something has clicked in and they feel much better very quickly. I know other people who have worked on this for years and years and gradually gotten better over time. I'd say, this is not precisely what you're asking, but it's what I've been thinking about for the last few minutes. I do think that we have a fairly good sense of what psychological issues cause pain in people, a lot of which you mentioned. And so the people pleasing, and where else did you put this here? The high achieving, the perfectionism, the obsessiveness, the overthinking, like all of those matter. And so all of those need addressing, I think, as you continue to get better. And so if you're wondering, like, what do people work on? And maybe you know that already, but the kinder you are to yourself, the more you give yourself space to try things and not have them work and learn and move forward, the more you think in terms of a growth mindset instead of a fixed mindset, the easier it is to reduce the pain, and then in what you're saying, to reduce the inflammation potentially also.
I like that you say
some of those things take time, right? You can't just snap your fingers and not be perfectionistic. It takes work and practice. And so it's not going to change, by the end of the week. But if you work super hard on all of this and make significant changes, within months, you're going to be feeling differently than you do now.
Okay. And I would like to know your perspective about something, because 2 things. One, because I see like sometimes in the brain part, like 2 different areas or 2 different topics. One is personality traits, that basically they are like trying to avoid some emotions, and that's why you develop that behavior. And the other one is by itself the trauma or fear to pain, treating like an anxious obsessive thinking.
Mm-hmm.
It's possible to heal, because I think Alan Gordon, for example, focus a lot on the area of changing your relationship with pain by itself. What do you think about these two? Like you work with both? It's possible.
I work with
You work with both.
And I think the model that I use that you, I think, understand is that pain's not about damage. Plenty of people with AS don't have pain, even if their sacroiliac joints are fused. And
my pain, most of the time is not there.
right,
I
exactly.
have pain all around.
Exactly. Yes. And so pain is not about damage, but it's about something, right? It's not random. We don't just randomly get pain. And so the best model that I understand is that pain's about danger or the sense of danger. And so then your job becomes to figure out, all right, what's dangerous for you? For some people, the danger is the pain. And so they have to be able to sit with the pain and understand that they're not literally in danger in order to get the pain to calm down. That's the somatic tracking that Alan talks about. For other people, the danger is the feeling. Every time they start to get mad, they get a migraine headache, or their back goes out, or their joints ache. And so then they have to be more comfortable with feeling the feelings and expressing them. For some people, it's the people pleasing, right? Every time they think somebody's mad at them, something happens in their body and they can feel it and they get achy and tight and tender. And so they have to be more comfortable drawing boundaries and saying, this is okay and this is not okay. And so that's why it's different for different people. For you, I think it's a combination of those things. There may be emotions in there that need to be expressed. There may be strategies to sit with the discomfort until you understand that it's not dangerous. You may need to somehow train your brain to be less obsessive, which is a common one that I see in people these days. You may need to clarify the negative thinking that says, this is inevitable and you're going to get worse and worse. There's probably not a ton of that, but for some people, that's a big part of it. And so you need to try to help your brain understand that the world is not dangerous, inner world, outer world, but that it's safe and you can be safe. You can be safe in how you think, you can be safe in how you feel, you can be safe in how you interact with other people. And the more you can do that, the calmer your brain will be.
I see. That make a lot of sense. Yeah. So it can be from both sides, depending of. I think in my case, I relate with both. Like, once I start learning about this, like I realized, like really, I put a lot of energy into observing my pain. I didn't realize, but I do.
Yeah.
And I react like negatively to that pain, right? Like with fear. So yeah. And also there are many things in my life that create internally a feeling of danger that I have been somehow suppressing.
Yeah. It's true of most people, right? At least in the States, like a third of people have pain issues. And so it's not uncommon for people to need to work on this. I think the advantage that once you understand TMS or understand that that's a possibility, then you have this advantage of opening up all these extra treatments that most people don't have access to.
Yeah.
Right. Most people with AS think that they can only take an immunosuppressive medication to get better. They think that's the only thing they can do.
Yeah.
And so you're way ahead by understanding that there's a lot of factors that come into play.
Okay. And from your perspective also, who are the best people to work with for this?
There's so many. That's probably too open-ended a question, right? There's so many good people and they do different things. And so let's limit it at the moment to like 2 or 3 people to work with. What do you think are the most important aspects for you to work on right now? as you move forward. Knowing that, right, it's not a like, okay, you need to do this and then you're going to be better, right? We're just trying to figure out how to calm your system as much as possible for over a long period.
I mean, the first thing that came to my mind is I would like to work 3 areas. That will be the brain, the exercise, and the diet. But so that will be the first answer. But also I should tell you that exercise and training is something that I have been doing quite a lot. So I don't know if there is so much range of improvement there.
Right.
So
It's from the exercise standpoint, Charlie Merrill in Colorado is my favorite sort of physical therapist, personal trainer type person. I don't know, honestly, how much he does at a distance. And like you said, that's not necessarily even the focus for you.
how is
But
called?
Charlie Merrill.
Can you write this on the chat so I can?
Yeah, I'm taking notes here. I'll send you my notes once we're done. And so it's Charlie Merrill. Let's see if I can find Charlie's website. I'm going to put this in the chat for you and also in my notes. So just go ahead and click on that link real quick so you have it.
Thank you very much.
So he's the best person that I know on the exercise side. There, we have a number of coaches and therapists on our staff. You're working with somebody already in Alan Gordon's office, right?
I am not working yet with them. I did the first the screening session, I didn't pay nothing just to understand how they work, and and they told me to talk with you.
Okay, got it. And so I have one of my coaches on our staff used to work in that office. I think she's outstanding, and so if somebody asks me like who's the best person to work on it, she I think is the best person. I can certainly introduce you to her. She's got a little bit of a waiting list, but I don't think it's super long. But you can look at her website. You can, she'd set up a short call to introduce herself if you'd like to do that.
I would love to.
Her name's Erica Walker.
Okay.
And oops, it's the shortcut, not the actual website. Let's try it. See that?
Super.
And then from a dietary standpoint, I've got a couple people who I know who we do some work with who potentially could be helpful for you. What kinds of things from a dietary standpoint do you think would be helpful?
I mean, I think it will be related with my gut health, and related with the balance of the microbiome and reducing lucky gut, to improve the permeability. I have been following gluten-free, dairy-free, no sugar, no carbs, like almost like a keto diet or low starch. I mean, it would be cool if there is someone that, I don't know, that they can do like even the test, of they take a test.
Let's introduce you to Jessie Haymeyer. She's in Geneva, Switzerland, I think. And let me see if I have her information. I haven't talked to her lately, but I think she's still doing all of what she's always done. Here's her website. I'm putting it in the chat for you. And she's the closest person I know who would do what you're asking about, thinking about.
Okay.
And be able to do it in an international setting too.
Okay. And in terms of the mind part, we have like the pain reprocessing therapy, that I understand that's what Erica does. I don't know if there are other tools, or because I don't know, like hypnosis or
Yeah, I think so. Hypnosis, psychedelics, all of it. And so that's what I was saying earlier. It's not probably any one strategy that's gonna, like, probably not one person's gonna have all the information that you need. I do know somebody who I think is really good at clinical hypnosis that I can introduce you to also. Let me see if I have her information here. Let me get you her website, Dr. Gupta. And so those are all good places to start. In the end, right, you may find that there are other people who are helpful for you. You may decide that there are other avenues that you need to go down. If I had one wish for you, it would be that this just stays really open-ended for a while so that you can delve into a number of ideas and therapies and not feel like, A, there's a time limit or time frame on what you're doing, and B, understand that very likely it's going to be a combination of therapies that are really helpful for you. Did you ever read the book Radical Remission?
No.
It's one of my favorite books on health and healing. It's about cancer. That's not your deal. And so you'd have to think about it a little bit differently. But she interviewed like hundreds of people about how they recovered from cancer when they weren't supposed to. Either they was told there was nothing that could be done, or they were told what to do and they decided to do something different. And there were 9 different strategies that bubbled up for them. Changing diet, using supplements were 2 of them. But the rest of it was trusting their intuition, taking charge of their medical care, releasing their negative emotions, enhancing their positive emotions, connecting with social support, connecting with a higher power, and being really, really clear on their reason for moving forward. And I think that's a really good model for how to think about healing from complex disease, especially using the power of our mind and our spirit. And so that would be a good one for you to look at. I would also look at the book, The Last Best Cure.
The last what?
Last Best Cure.
Okay.
That's about healing from autoimmune disease, understanding the role that trauma and stress play in the formation of inflammation. And so that one may give you some framework and ideas also.
Okay. I will check them. Yeah, what you say about the radical remission sounds like that strategy sounds like very simple and effective, Well, simple as the concept. Later applying that to your life.
Right. Yeah. And I think some really nice examples in there of people who were just really committed to getting better. Like they were told that they couldn't, and they're like, yes, I am. And figured out how to get better and what they needed to do. Yeah. I'm keeping an eye on time. What other questions do you have? What have I not answered for you yet?
Let me see. Well, I would like to ask you, we almost covered everything. 2 more things. One, in terms of tracking my progress, pain is for sure one, no? But what will you track?
Pain is the big one. The other, I think, for you would be inflammation. Like, I would want to know if that CRP level changes. Okay. And I don't, you haven't had a lot of other abnormal labs, and so hard to track much more than that on the physical side. But I would want to know where the CRP is. I also frequently just ask people how they're doing in general, and so I'm listening for that as well. We have some questions we ask every time about level of pain and how bothersome the pain is. And so I have those baseline levels for you. None of it's terrible, right? And so...
No, the last days, no.
Yeah, trying to make incremental gains on that. So total goes from 9 to 6 or 9 to 3 and 11 to 8 or 11 to 4. Yeah. And so keeping an eye on both of those also.
Okay. And I would like to ask you one more thing, like, how it is for me to share this session for the people that they are in my community?
I'm more than happy to have you.
Yeah.
Yeah.
Thank you, because
Yeah.
there is some information that we have been covering, and not everyone have the opportunity of paying this. And
I think that's great. And it's, what I would say to them, what I said to you in the middle there, right? Like, our brain is enormously powerful, and whether or not it's the complete answer, it's part of the answer. And so, especially here in the States, people are really happy to push their brain aside and say it plays no role at all. And I just think they miss out on tremendous opportunities to heal and to feel better.
yeah, I think this is so important, and because many people, because of the doubt,
Yep.
they decide not to enter at all, but not entering at all is not going to help you for sure. Yeah. So some benefit you will experience from this, right? In some degree. So yeah, and also I would like to tell you, really, if you are really interested, or for your research, or meeting these people that they heal, I can send you like their websites or contact.
Send me their information. I'd love to check it out and look at it.
Super. And also I will let you know something, that I am going to heal completely.
Yeah.
And I know you can say, like, Álvaro, you are telling yourself something that you don't know. Maybe.
Yeah.
But right now, like, it's not going to serve me another thought. So I have to put this thought in my brain every fucking day,
Yeah. And then once you have, then you can explain what you've done and how you've gotten there. And people want to hear. People want to know.
Yeah. So that, I think we cover everything.
Good.
Well, actually, look, there is only one thing. I don't know if this is related at all or not, but in one of my analytics of the lab, I have one marker that is related with the kidney. I am looking for it to show you. That was very high, like 3 times higher than normal. Let me show you here. I will share with you my screen. Can you see my screen?
Yes.
Is
AST? No, I see you. So I lost your screen.
You see my screen or not?
No, I just see you.
Okay, one second. Share.
Okay.
You see, is this one. AST serum.
That's a liver value. There are a whole range of reasons that can be elevated. How long ago was that drawn?
This was 1 year ago.
Yeah, so the first thing I would do is just repeat it and see if it's still elevated. There are all kinds of different algorithms about how to investigate that if it's still high. And so it's not dangerous to you. Like, I'd be worried if that was 3,000, not 100. But I always wonder, like, when it's elevated, why is it elevated? And so like I said, there's just, if you were here in the States, we'd retest it. If it was still elevated, we'd run some other tests. We'd get an ultrasound of your liver, just trying to get information about where the explanation is. But I'm not worried. I'm not going to worry about you later on today.
Super. And when the marker of the CRP, I have it slightly high, like it's 5.5 and it's supposed to be the maximum 5. What is, like, because sometimes the range is like, okay, so I am 0.1 and I am high, but what will be truly high? What is a range that you will say, like, wow, this inflammation is
20. Yeah.
That's something that you see in people.
Yep. Usually when they're sick, not usually when they're usually when they're acutely sick, like the flu or COVID. And so but that's where I would want to say, like, we should try to figure out what's going on and do something about it. I would say that 10's a pretty common marker. Like, if people are over 10, then I think, all right, there's inflammation that we need to address.
Okay. So 5.5 is quite normal.
Yeah, I would say that quite normal is less than 1. And so anytime anyone's between 1 and 5, I think there's some inflammation going on that ideally I would like to be better for somebody.
That's a great answer.
Yeah. Okay.
Okay. Thank you very much for your time.
It's nice to meet you. If you want to chat more, let me know. Let my staff know. Happy to talk more over time.
Super. Thank you.
Okay. All right.
Bye.